But I did that and he sent me $100 gift card. He goes, I got it all in before, then it rained for like
Yeah,
2 weeks. He goes,
yeah.
you saved me. And I'm like, you don't have, I mean, I
Yeah.
made money at, it's. But Kurt's that way.
Yeah, he is.
Said if I'm busy, I'll tell you,
Yeah.
hey, I can't right now. Just don't get pissed at me if I tell you the truth.
I tell you what, there's more fertilizer trucks and on our road that take a stick out.
Yeah, it's been a busy.
You know, when it went from, even Saturday, I remember going outside, I had my insulated pants.
I know.
Sleeve shirt, a
Oh.
sweatshirt and my Carhartt vest on. And by afternoon, I'm in a t-shirt
And you're sweating.
and I'm sweating.
I just talked to her about that.
I did too.
It's neutral, so we're not to mention.
Okay, all right.
It's not a thing, usually it's that neutral.
But you have this one.
Met with economic development.
Oh,
And then Terry Fawcett.
oh.
Stuff I had planned a month ago.
Yeah. I know how that goes.
Hi, JJ. Good morning.
There's nobody online.
Okay. All right, do have 10 a.m. We will call the meeting to order and rise for the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, at this time, we do have public forum. Denise, do you wanna?
How's it going? Do I see the people who were supposed to be here? Denise Weiss, Royalton Township. I guess everybody probably knows what happened at Royalton Township. Disappointing is an understatement. But one of the questions that I don't understand, and I hope that maybe at some point you guys can help with this or point in the right direction. When supervisors are threatened with lawsuits, when they are intimidated, when in a public meeting, as we're having now, that there has been brought up that if they do not pass the ordinance that was being proposed, that the people would give a 1% of their net revenue, which would have been about $100,000. And we only run on a $300,000 budget for the township. So they didn't pass it. To me, that's a bribe. I know that when we had the first draft with Pine County, you guys followed the Minnesota Association of Counties recommendations. You also followed the zoning recommendations that the OCM had put out. In between the first draft in August and the second draft in October, those protections for certain types of licenses were removed from the cannabis licenses. And I would hope, because I do know that one specific member was pretty loud there that is also on that subcommittee. I hope that there was no bribes that happened and that how you guys came to your conclusion wasn't based on lawsuits or bribes, because certainly that's what happened to us in the meeting last Tuesday. For residents, I guess, I would hope at some point Reese could maybe talk to us and find out what when there's a lawsuit, like I can't say I'm gonna be able to give $100,000 a year on a $10 million project for it to be in an area that isn't recommended by the state of Minnesota. So what is our recourse as citizens for something of that nature? Where do we go? What avenues do we have? I think everybody just wants fairness and they want things done properly. And that's, I think, all I've ever come to talk to you guys about is to follow those rules. If you have my contact information, if there's any suggestions, and please check into your own situation as to how you guys came to those conclusions. That would be great. Thank you.
Thank you.
Thank you.
Yeah, thanks, Denise. Patrice, did you wanna? Real quick before you go, I just wanted to make the comment that we're not trying to heat everybody out of here. There's some air handler, they're testing some stuff today, so we enjoy everybody here, but it is warm, definitely with the sun beating on us, so I apologize about that. All right, go ahead.
Patrice to Gray. If I have a seizure, which I did this morning, I hope somebody brings this.
This is a different rabbit trail today, so don't expect me to say what I've said before. You can listen this time. I know well over 90% of you were very young or weren't even alive during this time, so you didn't experience it. If you listen to the end, you might recognize something I say. Back in the early 70s and mid 70s, we experienced something called the hippie generation. In my neighborhood, we had what we lovingly called the long-haired, pot-smoking hippie freaks at the River Diner. The Graston Boy Scouts had a nice floating dock with a diving board at Little Walleye Landing by Graston. The neighborhood youngsters would go swimming together. One day we came home to tell our mamas that there were skinny dippers jumping from the diving board and standing on the dock. Their hair wasn't quite long enough, so our mamas went down to check it out and came home with a story that survives to this day from one of the mamas. Excuse me. At that time, we as preteens were still able to ride around the block, 6 miles, without needing an adult with us. Today's world is different, and we are in deep trouble when the pot smoking is encouraged so much that we have to grow and manufacture it less than a mile from where that generation was skinny dipping. A quote from a year-half-old article in the New Scientist, October 11th, 2023, "Weed isn't like it used to be. The psychoactive potency of cannabis is on the rise, which means that so too are the risk of potentially harmful side effects. With a growing acceptance of the drug around the world, as well as legalization in many countries and US states, regulators are asking one question with increasing urgency: just how much stronger is today's cannabis? There is no way to comprehensively assess all types of cannabis currently available, either legally or illegally around the world. But the data we have suggests that today's drug is much stronger than the weed of even a few years ago, let alone several decades prior." In the US, some of the most extensive research on cannabis strength comes from the Potency Monitoring Program, a project led by the National Institute on Drug Abuse and carried out at the University of Mississippi. The data shows a clear trend. Over the last 50 years, the average amount of THC in cannabis, the plant's main psychoactive component, has increased more than tenfold. In the middle 60s, a book was written called The Cross and the Switchblade, and a few years later, the book Run, Baby Run. This all focused on the drug culture in New York City at that time and the creation of what most of you have heard of today of Teen Challenge. The lawmakers and government officials are the children, grandchildren, and great-grandchildren of those skinny dippers, while cannabis is still federally illegal because it is a gateway drug.
All right, thank you, Beth, for reading that for her.
Thanks.
All right, is there any other public forum? I don't see any here. And Ryan, you don't have nobody? Okay. All right, we will look at the agenda. Is there any corrections or revisions?
Mr. Chair, members of the board, Dave Minke, County Administrator. Just a note that Shane Sheets, the director from the Midwest Medical Examiner's Office, is here in place of Dr. Piper, who was unable to attend today. And then just to reiterate what Chair Moore noted, they're testing the fire alarm system, which requires turning off the air handling. And so I apologize for that.
Okay. Do we have a motion?
I'll move the agenda. Second.
All right, motion by Holland, second by Nelson. Any discussion? All in favor, aye?
Aye.
Opposed, same thing. Okay, approve the minutes of the April 15, 2025 regular board meeting and summary for publication.
I'll move those.
All right, motion by Ludwig. Got a second.
I'll second.
Okay, second by Nelson. Any discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same thing. And the committees, acknowledge minutes of the committees, boards and correspondence, the surveyor's report and Department of Human Services, March 30th correspondence and financial reporting.
I'll move that.
Okay,
I'll second. Ludwig.
all right, motion by Holland, second by Ludwig. Is there any discussion on them? Hearing none, all in favor say aye.
Aye.
Opposed, same thing. Okay, consent agenda. I see we got a couple pages worth today, so. Someone wants to make a motion on them?
I'll move.
Okay.
I'll second.
Okay. I got a motion by Nelson, second by Holland. Is there any discussion on the consent agenda? Hearing none. All those in favor say aye.
Aye.
Opposed, same thing. Regular agenda, Health and Human Services Advisory Committee.
I'll take that, Josh.
Okay,
Mr. Chair.
We're gonna,
If I could interrupt, this, Becky is probably gonna cover.
That's what I'm gonna say.
same
I
Information.
think all of it.
And so if you were agreeable to hold this report until Becky's report later in the agenda.
I was just gonna say that when that she's gonna cover everything we covered in what you're, in that presentation. I just talked to her, so.
okay. All right, so we will just move ahead to Health Insurance Committee report. Who's taking that?
I'll start it off. Well, first of all, our insurance is in good shape. As far as what, the thing, but the place we may expect increases is in our stop loss. And that, we're gonna try to negotiate with that, with Blue Cross Blue Shield. And then the, Minnesota Paid Family Medical Leave Act. There was some discussion on that too, where are we gonna look into having an alternate insurance plan or go with the state plan when we implement that? That's pretty much most of it. We don't have any of the numbers yet from what's gonna happen, so it's just, but we're sitting with a nice fund balance, so we're in good shape.
I don't know if anybody's prepared today, but can somebody explain our obligation to the Family Leave Act and how does that tie into our regular health insurance, or does it at all?
I don't know if Jackie has a short response or I know we have had conversation about bringing that through to Personnel Committee to talk about the impacts and the county's obligations and then flowing that to the county board as a way to give a more complete update. And that would happen over the summer if that is agreeable.
That's agreeable. I'm just confused about how our financial obligation to that.
And
How
Mr.
we're gonna cover that.
Mr. Chair, if I could just add one note on the health insurance. So we went from a single versus family options
Yeah.
to a four-tiered system of family, employee plus spouse, employee plus children, and single. It had virtually no impact on the single policies. So we had about 50% last year. This year, we have about 50% single. The others, the family dropped to 28%. The single and children went to 12%, and the single plus spouse went to just about 17% of folks. And so the feedback that we got at the insurance committee was people were really satisfied with those options and felt that that had worked out well. And I know that was a hard decision to get to because we didn't know the impact and we wanted to be sure that it was financially neutral for the county. And so from the employee perspective, there was a slight increase, well, there was an increase
A shift, yeah.
to the family plans, but if you had family coverage and dropped to either of the other two tiers, you saw a savings.
That was gonna be my question is everybody happy?
That's what I was gonna say. They asked that, you know, are we happy, or is the group happy with Blue Cross Blue Shield versus going out? And they all wanted to stay pretty much with Blue Cross
Okay.
Blue Shield.
Good. All right. Midwest Medical Examiners of Office Annual Report, and we have Shane Sheets.
Thank you so much, everybody. Appreciate you having me today. I apologize that Dr. Piper's unable to attend. She decided to go to court instead today, so you got to deal with me in her absence. Are you guys still considered the fastest growing county in Minnesota? That's
Well,
still,
they haven't announced it yet.
not yet. The heck.
We have no data to their contrary, so yes.
I like it. Keep it, keep it. So I'm Shane Sheets. I'm the director over at Midwest Medical Examiner's Office. I oversee the forensic pathologists, all of our death investigators, and of course, the office and budget itself. And as of today, yeah, we're serving 37 counties in Minnesota. So that's 32% of the state population. And then we also do referrals for state of Wisconsin. So about 11 counties there. We're also doing Alzheimer's dementia research, so brain removals, which is significant with universities and brain banks. So you can find out what type of Alzheimer's or dementia you had. And for the Hmong population, since Minnesota is, I believe, still #1 in Hmong refugees, we also do hardware removals at our facility, which means when they pass, they can't pass away with any metal in their body or be buried with that. Otherwise, their spirit does not cross over. It's a cultural thing that we offer as well. And we'll do the hardware removal. We scan the body, remove the metals, and then families can make sure they're resting. We are also, of course, the Pine County Medical Examiner's Office. So happy to serve you guys. In the middle of it all, I had to look up your quote again today to see if anything updated. It's truly in the center. So if we go,
A clicker there for.
yeah, there it is. Thank you. There, it's working. A little bit about us. So assumed cases, that means that our forensic pathologists and investigators, we've been to the death scene. We've assessed everything, interviewed family, all of the works, and we have determined that we need to assume jurisdiction of the case. So that means it's not an apparent natural death. There's something we just don't know as to how that person passed away. And that can be medical record review if they're in the hospital, or sometimes autopsy. So that's what assume means. Decline means, and it's pretty cut and dry. It's cases where the cause of death was an obvious natural during our investigation. And that means that person's primary care provider can sign that death certificate. But we're still obligated to investigate that death for your community. So you had a total of cases reported to us were 250. So you had 262 deaths in Pine County. So 95% of your cases are people that passed away were reported to us. And those outliers, a lot of people ask, what about the other 5%? Well, those are typically your nursing home deaths, skilled nursing facilities like that. It does not include assisted living and also hospital inpatient. And looking at, get the hang of this clicker in no time. All right, so we have our Pine County overview, as you can see, for manner of death, and I'll go over some trends with you guys. But you have had 1 homicide this year in 2024, I apologize. Accidents, you've had 29. We'll break those down a little more because that does include drug overdoses. Natural deaths were 10. I mean, when we're investigating, if it's not an apparent natural death, 40-year-old male, 20, 30, you don't know. We just don't know what happened. They go to the doctor, there's no diagnoses. We're gonna do that investigation and find out for the family. And 7 suicides, and of course, 0 undetermined. We like to see that. That's oftentimes you'll have that with bones, or the investigation just isn't lining up and we have to go with undetermined. We'll go to your accident subclassifications. I like graphs, so we're trying to update our annual report every year to make it a little better for the commissioners. And if you're a fan of pictures too, as well as I am, let me know. Any feedback's appreciated because we have a new case management system. So we'll routinely update this with data that you're wanting. So I'll look forward to questions. But our subclassification is your blunt force injuries. You've had 12 deaths due to blunt force injuries. Biggest definition of that is just an impact on a dull object or a surface. So that includes your motor vehicle accidents. It includes people falling. A lot of times you'll have that be considered blunt force injuries, and it results in those fatal injuries. Drug substance abuse, you're at 13. Exposure, so environmental, hot, cold, you're at 2, 1 related fire death and 1 infant unsafe sleep, which we're routinely seeing a decline in that throughout the state, which is good. Education's getting out there on co-sleeping, what to do differently with your infant, and we take those investigations to heart and really try to stop and educate and find out what's causing the death of the youth in our communities. Manner of death by year. Now, this is where you commissioners can go ahead and look at a good comparison. It's also really interesting for public health, emergency management, the general community. But out of your incidents, 12 of these were blunt force injuries of your accidents. The 13 drug overdoses, you're tied with 2023. So we didn't see a decrease in that. Statewide, we're starting to see that go down. And that's very good to see. Fatal. I'm sure the sheriff or EMS can attest that maybe they're surviving due to Narcan, things like that, but we are seeing the fatal deaths go down. And at your 2 exposure, the same, 1 fire, 1 unsafe infant sleeping. When you do your comparison, homicides, you're down 1 from last year. So you still had 1 this year. Drug overdoses up 10, or sorry, accidents up 10. And then for natural deaths, down 3 from last year. So they're probably seeing their provider a lot more. People are going to the doctor a lot more. Prior years during COVID, people stayed at home a lot of times and skipped their appointments. And for suicides, that is up 1 this year. So suicides in 2023, there were 6. In 2024, there were 7. And a lot of times people want to know the trends of those. It's middle-aged, white male, firearms. That's typical suicides in Minnesota on average. We'll break it down a little more for you for your 4-year comparison. Accident not otherwise specified is 2, but you haven't had that since 2021. And yeah, it just gives you a better picture to look at the overall data and try to do a comparison for your community. But yes, we are seeing suicide rates start to decrease. We're seeing drug overdoses start to go down. And the big one, that exam or autopsy, we're going to be doing toxicology testing. And with, you're seeing present in the tox for your community of the deaths, and for methamphetamine present, there was 12. So methamphetamine and fentanyl are what we're seeing for drugs in Pine County. You haven't seen too much change there. I think overall, law enforcement, public health, emergency management, your education is doing very well. There's nothing that really skyrocketed in 2024 that's extremely concerning. I mean, every death is a concern to us, but we always want to see trends. What's happening? What can we do differently? You guys have any questions for us?
Hey, Doctor, do you compare our rural county to other rural counties? Is there a difference between a rural county and a metro county?
Yeah.
In drug usage deaths?
Yeah, usage and deaths 100%, because you're having a more compact community, right? I still live in rural Minnesota and we see it too. Drug overdoses, you look on it, yes, it's low, but how is it sitting to a county similarly situated, right? We're out in the middle. You have to drive 20 minutes to get groceries. What is your overdose rate? So that's oftentimes correlated with per 100,000 population. Looking at your data in comparison with other similar sized counties, it is about the same. And of course, if you want any specialized reports that you guys can think of, our new case management system, we can run it all. We're also importing data in real time. Once we complete our forensic autopsy, for any fatal drug overdoses, that information is getting immediately uploaded into OD maps. And OD maps is heat mapping fatal overdoses in your community. EMS and police use it for Narcan use, but we're using it for fatal too. So you can really see where it's hitting at in your community. But I think in rural Minnesota, we see a lot of methamphetamine still, and that just hasn't changed, unfortunately. That's a great question.
It boggles my mind that if in a county of 30,000 people that we can have 12, 13 deaths of drug overdoses, and the drug using community doesn't connect the dots and say people are dying when they use this stuff. And it would quit, but
Yeah, and we're always chasing it, trying to test for it too, and make sure we're looking at what's harming the community. And that's why like this xylazine stuff, you hear it on the news. Is it impacting you? Not right now, no. I mean, that's a benefit for you guys because you know what to focus on. I mean, methamphetamine, fentanyl education endeavors. But yeah, new drugs are hitting the market all the time. I mean, you've seen xylazine and you're seeing a lot of like veterinarian tranquilizers. It's really interesting in terms of drug use and what's hitting the market. But I can assure you we'll be testing for that once it comes. Any other questions?
Thank you.
Yeah, no, I appreciate you guys having us. And I'll leave my business card. Would you like that? Okay, I'll leave card and ME information for you guys. So please email me, let me know if you have any questions. And as always, as commissioners too, we're your medical examiner's office, so it'd be wonderful to come out for a tour and just see. I don't know how many years it's been. It's probably been quite a few.
I don't know.
Promise, it's very surgical setting, very clean and very professional. And I think you'd be amazed. We'd love to have you though, just to show you what of course taxpayer dollars are going to. And we see no rate increase for next year. Trying to think, there's one other thing. Oh, I will be president of the International Association of Coroners and Medical Examiners coming up in July. So if there's anything that your community really wants to focus on in terms of deaths in your community, just let us know. Because that's something we can bring up because our focus, and mine especially, is rural Minnesota where we serve.
Thank you.
All right. Thank you all so much.
Thank you. All right, 2024 child placement summary and child protection update.
Good morning, Mr. Chair, members of the board. My name is Becky Foss. I'm the Director of Pine County Health and Human Services. And I am here this morning to speak a little bit about 2024 out-of-home placement expenses and then provide a brief child protection update too, specific to a new law that is going to be coming into effect for most of Minnesota on January 1st, 2027. Here are the topics I hope to cover for you today. Just some basic broad context and information related to out-of-home placements in the Health and Human Services budget, the actual numbers, budget compared to what we expended, and what we do in-house to practically support and strengthen families to keep them out of child protection, out of placement, and out of deep end services. And then we're going to spend some time doing a little deeper dive into that future unfunded mandate that I spoke about. The acronym is up there. That stands for the African American Family Preservation and Child Welfare Disproportionality Act. And so if I call it the Act or if I call it MAFPA, please know that is what I'm referencing. That is just a mouthful, so it's just easier to call it the Act or MAFPA. Just starting with some context, in the Pine County Health and Human Services budget, we are responsible for budgeting out-of-home placements for CPS, which stands for Child Protective Services, CMH, which stands for Children's Mental Health, and then also probation out-of-home placements, excluding the RJC contract that is contained and housed in Terry's budget. I also want to point out that in addition to Health and Human Services and probation, we are also financially responsible for out-of-home placements for Mille Lacs Band Tribal Family Services placements when the children are residents of Pine County. And so we continually looking at what our trending data is telling us as we anticipate future years' expenses. So here's the numbers. And it's really, really exciting information. So for 2024, we budgeted a little over $1.3 million. You can see there the different big divisions in the HHS budget is child protection, probation, and CMH. So that first bullet point is what we actually budgeted under each of those areas. And the second bullet point lets you know exactly what we spent in each of those areas. And so we were under budget in all three areas, which I think is the first time in my tenure that that's happened. And another exciting thing that happened is for the first time, I think ever since I've been in Pine County since 2011, we expended under $1 million in out-of-home placements. In fact, we've had years where we've expended over $2 million. So this is something that's really exciting for Pine County. It's something to be proud of. And altogether, we were under budget by over $500,000 in those three big areas. I want to take you through some trending data for each of those major divisions, CPS, probation, and children's mental health. So here you can see our child protection out-of-home placement expenses since 2019. And really, generally what you see is a downward trajectory. So that is something that is seen all across the state. I can share with you in 2019, we were still dealing with the impact of the first legislative task force on the protection of children. And so with that came many, many, many more reports, more out-of-home placements. 2020 was the COVID year, and 2021 was recovery from the COVID year. And then from there, you can see, generally speaking, there's a little blip uptick in 2022, but then it goes down. And Supervisor Beth Jarvis is also here. She and her team do a phenomenal job. So we just want to share some kudos with her. This is trending data related to probation placement expenses, again, from 2019. You saw in 2019, out-of-home placements for child protection were significant, those expenses, as were probation expenses that year. So that was a rough year for out-of-home placements. But since that time, really, again, mostly downward with a little bit of uptick in 2022 and 2023. I do want to point out that in 2023, the RJC contract went into the probation budget. So there's a decrease there that is somewhat explained by the contract moving hands to Terry's department. Well, the contract didn't move hands, the expenses for the contract moved hands. Terry's always been in charge of that. And then in 2024, just more great work being done by the probation department, by Terry, by Sherry and their crew, just some good work. And in this slide, you can kind of see the trending data for children's mental health placement expenses. We talk and speak of budget busters when we talk about out-of-home placements. And this is an area where if there is a out-of-home placement for a child with a severe emotional disturbance, it is going to be a budget buster. Typically, when children need a higher level of care for their mental health, it's going to be found or accessed in a residential treatment center or a QRTP, which stands for Qualified Regional Treatment Program. And so those are upwards of $300 a day. And so there's a big difference if you have 2 kids in out-of-home placement versus 5 kids in out-of-home placements, and those costs are significant. So let's talk about 2024, because 2024 was a really fantastic year for out-of-home placement expenses. And what can we attribute that to? A lot of things, right? I don't think there's one magic ticket, or we would be doing that every year. But we have worked really hard on providing preventative and proactive services to our community members, because we also don't want kids to be in out-of-home placement. We want families to be thriving. We want families to be strong. Beth and her team do a phenomenal job of safety planning and only using out-of-home placement as a last resort. And Barb and her team do the same thing. We really try to provide community-based services whenever possible. Also in child protection, we really try hard to watch our caseload sizes. And so really proud of the work that we've done in that area. As an administrative team, I think the average caseload size for case managers right now is about 8. 10 years ago, it was probably 15. So we've worked really hard to manage that ratio. When I say that, I want to be clear that if you are a child protection social worker, 8 cases now is probably the equivalent of 18 cases back in the day, because the documentation requirements and what's required of the workers is more than what has ever been before. And also the dynamics that we're seeing with families are much more complex, ranging mental health, chemical health, really difficult barriers that we're trying to overcome with families. We also do a voluntary parent support outreach program, voluntary for families to participate in. We have the Family Resource Center. We have evidence-based family home visiting in public health, and that is going over 10 years strong. I'm really proud of that team. They've done some great work. And then we have a licensed independent clinical social worker on staff, and we do a great job providing internal mental health services and supports to our community. I also think it's important to talk about tenured staff who touch the child protection system. In a 2023 DHS study, the average child protection worker tenure was 2.5 years. That's a really sad statistic. It's sad for a lot of reasons, but Really, it takes 12 to 18 months to train a child protection worker. So by the time you're training them, you have a year with a fully functioning child protection staff. Thankfully, here in Pine County, our average tenure is over 8 years. So we're over 3 years, the state average, which is really remarkable. And again, a testament to the work that Beth is doing with her team. In addition to that, we just have a great system in Pine County. It's the social workers, it's the leadership, it's the nurses, it's the attorneys. I specifically want to call out Assistant County Attorney Sydney Silko. She is amazing. She handles all the CHIPS cases with some help from Maria and just does a phenomenal job and has really been doing that for several years now in Pine County. And when you have a tenured staff, they're not easily rattled and you can really work through a lot of things together. Looking into the future. So if I had my crystal ball in front of me today, what would it tell me? It would tell me what you see in some of the trending data. Our out-of-home placements in child protection are trending downward. There is an increased scrutiny related to out-of-home placements in child protection. So placements do not happen easily, nor should they. Additionally, we are seeing added requirements, added unfunded mandates that are going to hit our budget in 2026 as we ramp up for 2027 services. So that's something to also keep in mind and something I want to be very clear in calling out. Let's go deeper into this, the new act that's coming into effect in 2027. It was passed last legislative season. And it was passed with broad support. Both sides of the aisle supported this new law. Our local legislators also voted to approve. It's covered and spelled out in Minnesota Statutes 260. It's a lot to take in. So some of these slides are a little long. I am not going to just read them off, but I do want to talk about how big this law is and what it means for Pine County. The purposes of the law are this. It's really to protect the best interests of African American and disproportionately represented children, and really focusing on family preservation and reunification and improving outcomes, permanency outcomes for children in the system. Active efforts is something that's really referenced a lot in this law. And here's what the definition means in statute. So just a couple lines there. It means a rigorous and concerted level of effort that we have to do as a health and human services agency throughout the life of a case in the child welfare system, specific to an African American or disproportionately represented child and the child's family. So the key words there really to start with are active efforts. Active efforts is interpreted differently. There's no one easy definition that we can all support. If you are a stakeholder in the child welfare system, if you're the judge, what you may think is active efforts is not what we think are active efforts. And the same goes for the tribe. They have their own definition of active efforts. Sometimes we as a local social service agency are told that we are not doing enough and we are not providing active efforts from other people's viewpoints.
Were you going to move on?
I don't have to.
Can I ask a question?
Sure.
So can you give any examples of active efforts? Because I know as a person who is not in child protection, the types of things that the county does and the county workers are responsible for was a whole new universe for me.
Yeah. The
Yes.
example you gave us in.
Yes, I can give lots of examples. So could Beth. So at any point, Beth, if I am not speaking well enough, please feel free to come up. But there are a couple examples I can think of right off the top of my head that have been provided to families. This is just very recently within the last 2 years. So we had this is an ICWA active efforts case. We had a mom move across the state. She burned through some transportation providers because she was a no-show, no-call. And after so many times, the transportation providers are not going to pick you up. And so we are still charged with doing active efforts. So we had to locate a transportation company to bring mom from across the state here to Pine County. And for 1 weekend visit, just for transportation costs, that was a $1,000 bill to the county. Again, that's active efforts.
So active efforts in this case, somebody in the court system, the tribal system says you must have visits with this person
Yes.
to their child, no matter what it takes.
Yes, yes. Additionally, that same family, we provided rental assistance as a county organization for 6 months with the understanding that we're going to help you get set up. We have 6 months, we have you covered, and that was also expected from the rental agency. So we provided 6 months of rent with the understanding that it was going to be up to mom to work the case plan and be able to financially afford it moving forward. That did not happen, and mom got evicted. So that was 6 months of active efforts and rental assistance that we provided. That same case, when mom came to visit her kids for a visit over the weekend, when they were doing unsupervised visits, we had to pay for the hotel and we had to pay for food for the family for that weekend. So again, active efforts is a very high bar. And truthfully, it's an expensive bar.
And so just to wrap that up, the purpose is to reunite the family
Mhm.
and ensure the safety of the child.
Yes,
And different families require different things. And it's not usually or not ever, well, it's never solely at the discretion of the social worker. Right?
correct.
It's at the discretion of others that say, this is what you must do, regardless of the cost. And so I think when you look at those charts, right, of how they vary from year to year to year, is each case is very different.
Absolutely.
And so this act will apply that standard to we suspect virtually every child protection case in Pine County.
Yes,
And the value of that is, from a state policy perspective, is the legislature believes that every child deserves maximum efforts to be safely reunited with their family. And provided no funding.
yes.
With no funding, yeah.
No funding.
Our funding.
I had a question on that backslide on the bottom. You have courts, public defenders, et cetera. What's the GALs?
Oh, sorry. GAL stands for Guardian Ad Litem. So
Sorry.
Guardian Ad Litem. So a guardian ad litem is appointed by the court in all child protection cases to advocate and represent the child's best interests.
Guardian at or
Ad, AD, Guardian Ad Litem.
ad litem?
Yeah.
Disproportionality is another one of those big words that is covered throughout this law and stated over and over. And what it means is the overrepresentation of African-American children and other disproportionately represented children in the child welfare system population as compared to the representation of those children in Minnesota's total child population. That's a lot. So instead of just reading that, I'm going to give you a picture, a pie chart of a local example of disproportionality. So my left. So the first pie chart is like the general population in Pine County. Depending on the census you look at, 3% of our population is American Indian. The other 97% is non-American Indian. And then if you take that information and just compare that to what our child out of home placement looks like, you all of a sudden see that blue piece of the pie chart expand measurably. And so you can see there, that's a local example of disproportionality. So if you look at what this law shares, it shares that we must be in Pine County doing something wrong. And I agree, when you look at that pie chart, that looks horrific. It looks like what is happening and what is Pine County doing. So we're going to come back to this pie chart in a little bit because there's more to it than just the data. The data doesn't capture it, and I don't know that it feels like everybody's interested in learning more information behind what the data is sharing. Moving on with the requirements, there's some bold and italics highlighted here that really speaks to County Administrator Minke's point regarding why we think this law may impact so much of our population. It is a child under the age of 18 whose race, culture, ethnicity, disability status, low-income socioeconomic status is disproportionately encountered in the child welfare system as compared to the state's total population. That's nearly everybody we serve in child protection, either low income, disability status, different things that are happening within their household. And the tricky thing too is there's another little phrase that's bolded later on that says on an annual basis by the commissioner. So not only is it pretty ambiguous and yet all encompassing, every year that definition could change based on what the DCYF commissioner states as this is how it's defined this year. So that's difficult if you are the local social services agency responsible for this act and for following the requirements. It's different when the definitions, it's difficult when the definitions keep changing. Then the law has a lot of information about what is required on the case review. So when you as a county board member, or when I as a director hear like, oh, each case has to be reviewed, that makes sense. We should be reviewing each case to make sure we are making good, healthy decisions and really engaging parents and families in the child welfare system. So that all makes sense. However, the requirements in law are much more complex, and we can't get the data from SSIS. We've had numerous conversations at this level about SSIS and what it can and cannot do. It cannot do much, period. And it's an old system. It was created in 1990s, and you're gonna see all the things that are required of us and why this feels like a pretty impossible task. So the case review, the first case review report isn't due till 2029. And we have to start reporting data in 2028, so November 1st, again, with guidance from the commissioner. So what does all that data look like? What are we supposed to do? I am not going to go through each one of these enumerations, but I can tell you, you should be very concerned about what we are required to report, because there's no easy way to get this data. And when I talk about my estimations of why I think it's going to cost so much to be in compliance with the law, one of the reasons is we're going to have to hire a data specialist, because there is no way that any of my staff have time to do all this. And SSIS doesn't support retrieving this data or identifying this data in an easy way. As you can see here, everything that is going to be required. And the list goes on. There's a piece of the law here that I have highlighted about what is going to happen if the case reviews show that we're not really doing very good in compliance with this law. We will have to work a remediation plan with measurable outcomes that have to identify, address, and reduce the factors that led to the outcomes that we're seeing. And it also has to include information about how we're going to achieve and document trauma-informed, positive child well-being outcomes through all of these remediation efforts. Why am I so concerned about that? For lots of reasons. Why I'm concerned about this law. First of all, again, SSIS doesn't support what it's asking for in the law. And so it's going to take a lot of manpower, human power to get through that. Local examples, going back to that slide of the pie charts where it looked like there was a significant disproportionality that exists in the Pine County child welfare system. I want to talk more about those cases, because that data is effective mid-April is when I ran the data. Again, that pie chart where there is disproportionality in Pine County's child welfare out-of-home placements. So of the kids, I believe it was about 33 that were in placement, 14 were Native American children. Of those 14, 12 of the 14, nearly all of them were having their cases heard in tribal court. So we were just, I don't want to say a bystander, because we have more to do with it than that, but we are not leading those cases. The tribe is leading those cases. And of those 14, 4 of those 14 were placed in the last year. So what we see with active efforts cases, and this is really, really important to keep in mind, is the cases last a long time. They are not wrapped up in a very timely way compared to reasonable efforts cases. And what that means is that we have workers investing a lot of time and a lot of services, and frankly, just a lot of money into cases to keep up with that active efforts bar. I also want to point out that of the 4 children who were placed in the last year, they were placed by tribal social services, not by Pine County. And again, that's not a piece of data that can be captured out of SSIS.
I know you've told me this before, Becky, but the average stay in that system for a non-native kid is, I believe, just a matter of months.
Yeah, well,
That's
you
what
have 12, as a parent, if child protection asks for removal of the child from the home, from either the court or from law enforcement, parents have really 6 to 12 months, depending on the age of their children, to get their act together. And if parents aren't complying with the case plan under a non-active efforts case, you can really petition the court to do something sooner, to follow Plan B sooner, and then Plan B can be executed by the court if that's the way it goes.
It's just, if I may, to elaborate on Steve's point, the reason that chart is accurate, but I don't know if misleading is the right word, is you can only use it to count the number of kids in out-of-home placement at that moment in time, not the rate at which children are put into out-of-home placement.
Right.
And so if you have an ICWA case that comes in on day one, and that child is in the system, right, for 10 years, because permanency is a different
They're
thing.
still in that blue.
They
part
will
of the
show up
chart.
for 10 years.
Mhm.
Versus if you are a non-ICWA case, the expectation is that there's a permanency solution within about a year.
Mhm.
Does that make sense? That it's a great measure of here's what is in the mix right now, but it's not the rate. And so it doesn't show that, it does not show at all what rate children are being put into out-of-home placement, which is an elusive statistic. But to me, it's a
I think it's what story. Cause if just 4 of them got put on in the last year, that chart would
It would look different.
look tremendously different because you'd have 10 of them that didn't show up in that chart.
And so understanding the data doesn't at all address how should these cases be managed. It's just trying to get clarity on what does the data say, and let's not interpret the data to say something that it doesn't.
Mr. Chair.
Yeah.
So you know, if the tribal is placing them, I know there are juveniles and the
Yep.
county is still responsible.
Yep.
But the tribe treats them completely different in
Yes.
these settings than what we would
Yes.
do. So we're kind of trapped. in my
Yes.
mind.
Yes, the tribal state agreement makes counties financially responsible for expenses related to child protection casework done by tribal courts, tribal agencies. And so we are financially responsible for the cases, and there's just a different philosophy from a tribal viewpoint about what should happen. So this is not a bad thing. It's just a difference in philosophy that it is, I don't think in my whole career, I don't know that I have worked with a tribe that endorses or supports a termination of parental rights. They really work hard at reunification. That's what they want to see as the outcome. And that's correlates to this new law in some ways, because in some of the
I think it's
verbiage in
huge.
this new law, it talks about termination of parental rights not being the first choice, a transfer of custody to a relative. And so if you can't find a relative or find a relative who can pass background checks, it leaves you as a local social services agency in a really difficult predicament, because kids are going to be in placement longer.
Yeah.
And to that point, a young woman just exited our child welfare system who was in tribal social services. And she had been in placement for, I believe, 10 years. So this is not something that we take lightly. The active efforts piece is really important, and what that means for permanency outcomes.
So I'm trying to choose my words careful here, but so how we would typically resolve a case with another kid? Their culture resolves it differently.
Yes.
It doesn't care how long it goes, as
Yeah.
long as there was someone. Right? That
Yeah.
like culture.
And really focusing on, if there's no family, kiddo's gonna stay in foster care until we find a family member, because we're not gonna do a termination of parental rights.
But they count against our data.
Yes.
Thank you.
So what we know about the act right now, at this very moment, is Hennepin and Ramsey counties, this is in effect, they're the phase-in counties. They had to start doing this work January 1st, 2025. What we know right now is some of the definitions by DCYF. What they've agreed on is disproportionality or disproportionate populations include African-American children, American Indian children who do not fall under ICWA MIFPA, and then also kids who are comprised of more than 2 races. So that's the definition of disproportionality and disproportionately represented children right now. Again, the commissioner decides on an annual basis what that's going to look like. So that could look very different by the time 2027 rolls around, which is when we would be responsible for being in compliance with this law. I can't state this clearly enough. Both Beth, Supervisor Jarvis, and I have a lot of experience in child protection, and we have a lot of experience in what active efforts looks like, both as a frontline child protection worker for both Beth and me, for our child protection supervisor, and as a director. We know what this means for Pine County, and so we cannot stress it enough or come to you in more confidence about what this means for you, for your constituents. Here's just a local look. So these are real cases coming out of SSIS, analyzing the cost between reasonable efforts and active efforts. And this was an exercise we also had to do for the state legislative budget office. So this comes from that as a result of that. The directive was really to try to find cases that were comparable between reasonable and active efforts cases. For all the reasons we just talked about, it's really difficult to compare the two. But when we just took a look at cases side by side, you can see here financially what active efforts means for Pine County Health and Human Services, for Pine County families. And you can see on the column way over the worker time that is spent on these cases. And it's just a tremendous difference. The bar is much higher for active efforts. So what are our next steps? So MAFPA's coming our way. It would be wise of us to ramp up in 2026 to be ready for January 1st, 2027, when it's the rollout date for Pine County. In addition to all this unfunded mandate, Supervisor Meacham and I are keeping a very close eye on what is happening at the state level, because the Minnesota House, the Minnesota Senate, and the governor are all proposing cost shifts to the county for home and community-based services, for behavioral health services, and for sex offender programming services. So there's going to be some cost shifts. In addition to ramping up for MAPPA, we are preparing for cost shifts likely to happen, which you should be very, very concerned about. As a result, I know that I've been given the directive that I need to present a first budget in late May versus when I usually do it in early August. So I will do that. And hopefully by the end of May, we also have more resolution to what exactly is going to happen with the cost shifts. To that end, next steps, I would really encourage each of you to reach out to your legislators, because all these things combined have a serious impact on Pine County and Pine County taxpayers.
Question? Yeah, Mr. Chair. So for 2025, do you have an idea how we're running, like out-of-home placements in the child mental health? Are we
Yep.
staying in, are we doing good still?
Absolutely. So in children's mental health, I think if things continue, we'll probably be right on target for being at budget, maybe a little under. Child protection is running under right now, under budget, and probation is also running under budget.
Okay, thank you.
The year is young.
That can change in a week.
That can
And
change.
we all know that
In a day, yeah.
one family can
Yeah.
skew that thing like
Yes.
crazy.
Yes. And I've talked before about sometimes it's like, it's just good luck. So that's oversimplifying it. We have a lot of dedicated staff, a lot of hard workers. Maybe more appropriately, it's the absence of bad luck. Maybe a family of 10 doesn't come into your county needing a lot of services. So that's helpful.
Mr. Chair, I have one more comment.
Yeah.
So I worked with your people for a whole
Mhm.
career, and they always did the best to reunite with the family, and it was the first thing we ever did when we were pulling kids. So I look at this and I go, I hope it doesn't make us say, well, I don't want to take action here because it's going to cost us so much money and we have, it's going to burden us. So, and I'm not saying that as I don't think our staff would ever do that. but it almost looks like the law is pushing you to let little cases go and just take the big cases, you know, and I don't know if there is such a thing as a little case, because they all, you know, they build over time, you know, that when you first, the sooner you can grab those cases, the better to me.
Yeah.
I don't know if that makes sense.
It makes absolute
From
sense.
From where I was when I was working, that makes sense to me.
I will say that we are, I think Beth and her team, and she can correct me if I'm wrong, are very judicious in screening and reports that meet criteria for a
Well, I
child
don't
protection
doubt, I
assessment.
don't doubt your staff.
I will also say, though, when the decision comes to providing ongoing case management and potential removal of children from the home, there is a higher level of scrutiny than there's ever been before.
Yeah.
And so I think that's the pressure under which we all work in. None of us want bad outcomes for kids. We all want great outcomes for families. So we'll continue to do the best we can, knowing that there's a lot of pressure in this field. But
Thank
there's
you.
a reason for the 2.5-year tenure.
Thanks. It's so important.
Mr. Chair,
Mhm.
just a follow-up. So you said there is more scrutiny to those decisions for placement out of the home?
Yeah.
Who makes those decisions, or how are those decisions made?
So when a child is first removed from the home, that can only come about one of two ways in the child protection world. Either law enforcement places the child on a 72-hour hold, or we petition the court for a hold and for custody of a child. And so we cannot enter homes and just snatch up kids. That's just not what we do. Can't do that. We wouldn't do that. But that's how it works in this state. That's the only one of two ways that you can do that. And so once it meets that level, then you have to be in court with a certain amount of time. And so we have to connect and consult with the county attorney's office to make sure, like, hey, is placement still warranted? Could we do something different? And could we safety plan this instead of taking that next step? And then once it's in court, it's really up to the judge to decide what happens for next steps.
Any other questions?
Just an observation, it seems correct me if I'm wrong, this definition of disproportionate
Mhm.
seems to be written so we would think that, well, there's a certain demographic, but it seems that everybody falls in that disproportionate.
That's a concern, yes.
Good.
It could. Okay, next question, and maybe our administrator can elaborate on this. There was a proposal by the Mille Lacs Band to take over something?
Oh, not happening.
Well, yes, I just want to get some clarification on what that would have done. Would that have alleviated some of this? Was there some funding, and where is that at?
Mr. Chair, Commissioner Nelson. So that is called the Initiative Tribe. And there's a statute that lays out the criteria that any of the 11 tribes in Minnesota, I believe, are eligible to pursue that. Two of them, I believe, have done that. Red Lake and is it White Earth
Mhm.
have done that. So if a tribe is an initiative tribe, they take over the provision of a variety of social services, and child protection is one of them, but not the only one, correct?
Correct.
And so Mille Lacs Band was pursuing that for several years. And as of over the winter or last fall, at some point, there was a decision that they made that they were going to stop pursuing that it was not something that they were interested in at the moment. If there is an initiative tribe, many of the fiscal responsibilities then would transfer from the county to the tribe.
Yes, and to that point, the state, when it came out with its budget proposal, DCYF, they saw some cost savings in their budget because the tribe no longer was pursuing Initiative Tribe. Keep in mind, that's still our expense at a county level, but the state saved some money in their budget process.
Do you know what that amount was that they were, that in the governor's budget that they?
I believe that the 2-year amount for the biannual budget was either roughly 14 or $16 million.
That tracks. I was thinking 8 million a year, but I wouldn't want to be quoted on that.
Is that,
But they didn't give any savings.
No, it should, so my next question is,
Good one.
should we be really encouraging? I don't know, the Mille Lacs Band to reconsider this? You know, would it be in our best interest for, I don't know, I'm asking that question.
I think that's a decision that the tribe has to feel comfortable making when they feel like they have the
Right.
resources in place. And so I think we are only going to see so much traction if we try to encourage that. We've been encouraging it for years because I can just speak for our philosophy is we believe tribal children are best served by the tribe. That's what should be happening. We want them to, they're a sovereign nation and we would encourage them to do that. But I think it just takes time to build up the infrastructure and the support and services.
Cause we met, what, a month ago? I mean, if that was a big concern of ours or something we would like to see them pursue, cause they were actively pursuing it, you know, and so maybe that's a subject for revisiting, saying we really would like you guys to, you know, take us additional looks at this.
There's two pieces of feedback that maybe give part of the reason, and I don't present this as having any insight into the Mille Lacs Band's decision-making, but I do know that they struggled with retaining qualified social workers. And I think that's a statewide issue. So staffing was very difficult. And then the challenges presented by SSIS, I think, was a deterrent for them because the information is so hard to get and the amount of work on the paperwork computer side is so extensive that you're really not doing social work in the traditional sense. You're not helping the family or the children, you're documenting what's happened.
I also want to point out that with this new law, with MAPPA, if something doesn't change, I don't know how much it's going to matter because we're going to be doing so much work and expending so many services for so many cases that it may not rise to needing attention because so many other things are going to need attention.
All right, well, any other questions?
Yeah, back a few pages. You broke down, you have some money
Mhm.
on reasonable efforts versus active.
Yes.
I was just wondering, you know, like you have on the middle one, case number 2, you take the 479 hours of active and divide it by the 283,963. It's 592 an hour. Then if you just did reasonable efforts, it was 112 an hour, which is 226 hours. I mean, it's half the hours, which is the 10 times the dollar amount. How, you don't, if you have one case, I guess I'm trying to figure out how do you do reasonable efforts? And then how do you do active efforts on the same case, or am I looking at this wrong?
I think you're looking at it wrong. So they are two different cases. A reasonable efforts is, let's just say, case number 1A, and active efforts is case 1B. I do have it broken into how many hours are spent on each case, but in addition to worker time, those expenses also include services and resources. Could be foster care for the child, could be services for their parents. So it's a lot of costs are wrapped up into that, including the worker time.
Okay.
That answer your question?
Yeah, thanks.
Would be an example where you had to pay the hotel bill, you had
Yes.
to pay housing, you had to pay transportation,
Yeah.
you had all these additional costs beyond just the worker time.
Correct.
Got it.
All right, well, thank you. And I seen, so that
Thank you,
was,
Becky.
I'll stay close by.
Thank
that
you.
was our advisory committee report as well.
Yeah, and Mr. Chair, there is one action from the advisory committee. If you go back to that committee report on the agenda, it's terminate the Blue Cross Blue Shield Care Coordination Delegation Agreement at the end of the year. So if you want to discuss that, that was not specifically addressed. Maybe if you want, Becky can give an overview of that.
Yeah, maybe.
Becky can do a much better job than I can. But we have terminated with another provider in the past year. And that seems to, you know, it's, if somebody was on UCare, is it the one? Yeah, that, you know, they're still on UCare. It's just that their person that help guide them through that is now somebody that UCare contracted with Pine County. And so we had a person doing that. Now they contract with Lutheran Social Services to have somebody do that work. And the same thing will happen with Blue Cross. We will terminate the contract, and we have 3 people that work with that Blue Cross contract. We're so far behind in other work that those people will be just shifted over to do other work. And instead of hiring 3 more people to do the behind work, it's up to Blue Cross to contract with somebody else, like Catholic Charities, Lutheran Social Services, someone will pick up that work.
I hope it's okay that I'm speaking.
yep.
So at the Health and Human Services Committee, we talked about the Asian Disability Services Unit, which is supervised by Pat Meacham, who is also here. Over the last couple of years, what we've seen is our wait list for MnChoice's assessments has not gone down. In fact, it's done the opposite, it's increased. And we've tried everything within our power to not have a wait list. We've done overtime, we added a staff several years ago, we've cross-trained staff, so we're at the point where we need to do something different. I could be wrong, but I don't think, I could be reading the room wrong. I don't think there's an appetite to hire more people. And so I think that's left us to figure out how are we going to manage this mandated service. We do this non-mandated service in Pat's unit called Care Coordination for Blue Cross Blue Shield for individuals who are 65 years and older. It's a service that they get under their plan. And we'd like to modify our agreement with Blue Cross Blue Shield to no longer provide that service, redirect those resources that we have to mandated programs, including MnChoice's assessment and home and community-based services. Otherwise, I think we're going to be leaving everybody in an unenviable position, trying to figure out if we should hire or what our next steps are going to be.
Okay,
Did we make that clear enough to people that it's the 3 people that are doing Blue Cross will do now mandated services. And this Blue Cross contract is not a mandated service. And somebody else, Blue Cross will have to figure out who's going to do it.
so we need a motion on that.
I'll move that.
I'll second that.
Okay, is there any other discussion on terminate the Blue Cross Blue Shield Care Coordination Delegation Agreement at the end of the year? All right, hearing none, all in favor say aye.
All right.
Opposed, same thing. All right, well, thank you for all that information. And we will move on. National Corrections Officers Week. And Rob.
Mr. Chair, members of the board, my name is Rod Williamson, Jail Administrator for the Sheriff's Office. I'm here to present to you Resolution 25-17. I believe you guys have that. Recognizing and honoring group of professionals who work is so often overlooked, yet whose role is critical to the safety and the order of our communities and our corrections officers, or they are our corrections officers. I would love to have a lot of people up here, but unfortunately, they're all locked in with our clients. And once they're on shift, they're on post and they can't come up. But speaking on behalf of them, most people, they're unaware of what is involved in housing inmates in our county jail and the ever increasing responsibilities being placed onto the corrections officers throughout the state and the nation. Officers are highly trained professionals performing their duties in many times unfriendly environments, working with individuals who are oftentimes at their lowest. The dynamics of our jail population have experienced significant change over the last few years. While our total numbers of inmates on a daily basis has dropped, the actual number of vulnerable individuals in medical or mental health crisis landing in our jail facilities with significant care needs has increased dramatically. I'm very proud of our expert work our corrections officers provide each and every day, and sincerely appreciate and thank them for all they do for the sheriff's office and the citizens of Pine County. So before you, I present Resolution 25-17, recognizing the corrections officers of Pine County during National Corrections Officer Week, this first full week of May in 2025. Thank you. And I believe you do have the resolution, correct?
Yep.
Correct.
Okay.
I'll move resolution 2025-17.
All right. We
Thank
got a
you.
motion. Thanks, Rod.
I'll second.
All right. Waldham seconds. Is there any other discussion on that? Hearing none, all in favor say aye.
Aye.
Opposed, same thing. All right, Emergency Medical Services Week. You have someone to,
We do it every year. It's just EMS. It's the EMS week recognition.
okay. All right,
I'll move that, Mr. Chair.
okay. We got a second.
I can
All right. We got motion and second. Is there any other discussion about resolution 2025-18 proclaiming the week of May 18th through the 24th, 2025 as Emergency Medical Services Week in Pine County? Hearing none, all in favor say aye.
Aye.
Opposed, same thing. Okay, Commissioner updates, Highway 23 Coalition. Well, we went to that. Arrowhead Counties,
Didn't go.
okay? Arrowhead Economic Opportunity Agency. All right, we're striking out. District Court Security Committee meetings
That was canceled as well.
canceled. NLX,
I didn't attend it.
okay? Housing Redevelopment Authority and Economic Development Authority,
I went to that, Mr. Chair.
okay?
April 23rd, they had a meeting. They went through it was a standard report. Everything was fine with the buildings and things like that. They had the audit that was approved and unmodified opinion. Then they presented and accepted the local housing trust fund grant and stuff to the city of Sandstone, which was funds they did. We talked about before, the 48,000 and another revolving loan thing for the rock project. Then there was considerable discussion on the Hinckley childcare thing, building the 302 Fire Monument building. They met, I think Leslie met with 3 contractors on site. There's more, the bids are due May 7th, so we don't know what's going on there. But they discussed the other building that out in the industrial park that used to be the US. Yeah, that one. And then in that discussion, 2 of the board members said they may have to abstain because they know people or whatever. So that one's kind of sitting there. Who knows what's going to happen?
Mr. Chair,
Mhm.
the HRA EDA held a special meeting last week.
Oh,
And they did review the issue. So there were 2 HRA EDA commissioners who had a potential conflict and
Yeah.
wanted to abstain from that vote.
Right.
By happenstance, those 2 weren't able to make the special meeting. So
Oh,
the
okay.
3 who were in attendance reviewed the situation, reviewed some feedback from Deed, where Deed was pretty clear that they were not going to extend the grant. And so if the building location was switched, that would mean that the Deed grant would be given up. And so the 3 commissioners who were in the special meeting took no action after discussing it, which means that the original course of action to proceed with the original plan is what's being executed.
okay. So thanks, Dave. So does that gonna take what Roger was bringing up with the school off the table too in the future?
I think the school can still be on the table in the future.
Okay.
but we're just running into problems with the deed grant that clock is ticking.
Okay. Thanks. That's it, Mr. Chair.
Okay, sounds good. Zoning board?
Oh, it's me again. Yeah. I'm gonna find it. Yeah. They had a meeting. It was pretty standard. I guess I can go from memory. They had two variances presented and both were denied. Did the worksheets and did everything in the public hearings. And then there was discussion about Royalton Township and their zoning issues and that's gonna come back to us at some point. And I think Denise was addressing that today. And so that's coming our way. And that's pretty much it.
Okay.
That was on the cannabis zoning.
Snake River Watershed Plan Partnership, I did attend that. We had a good meeting. We kind of got a little bit newer of a board there. So this was, one of the working meetings. They got a lot of good stuff going on. One of the big projects that's going on is the North Bay of Pokegama Lake. And this actually ain't a planned partnership. This ain't a Snake River, a funded deal, but the Pokegama Lake Association is doing a nano bubbles trial in the North Bay of Pokegama Lake. And it's supposed to clean the water up. It's very expensive. They fundraised for it. They got the money. They're pretty excited about it. It'll be interesting to see because that's probably one of the worst parts of the lake. So to tackle that, if it works, they might look at doing the whole lake, but that's, we'll see how it goes. So they may come here this summer and just talk about it real briefly. I did invite them and, be kind of interesting to see what happens there. Otherwise, it was just a good meeting where it's far different than what I ever was with Snake River Watershed. The other one, the previous one that I already forgot about, for a good reason. But the One Watershed, One Plan, they got the steering committee that really provides some good projects and they just get stuff done. So it's good to see. We may have a representative from that come and just kind of explain what's going on in the Snake River Watershed as well, sometime here in the future. So I did make that comment and, Paul Swanson was there and he may come. It may be our plan partnership, director, but we'll see. We'll figure it out. So. Lower St. Croix Watershed Partnership.
We had equally as good a meeting. It's a great group of people. The unique part about the Lower St. Croix is we have a combination of metro dollars because of Washington County's involvement and Chisago, Isani, and Pine County. And Pine County is, our total acreage as compared to the whole watershed is quite small, but we are the headwaters of Rock Lake, of that arm of the watershed. And so it's been wonderful to see them understand that if we're sending polluted water out of Rock Lake and down Rock Creek and all its tributaries, it's too late to do something down at Lake St. Croix. You gotta start at the headwaters. So we've done well, and Paul Swanson is a major part of that with their steering committee, and we've got good projects going on. One thing we are going to talk about this summer is the fact that we're not our own entity. So next meeting, we will see a resolution that comes for amended work plan. And so that part is cumbersome to many of us, where the steering committee comes up with these plan amendments, then it's got to come to us, then it's got to come to each board for approval, and then go back and the work can actually get done. So it's about sometimes depending on the timing of it, it could be a 4-month gap between to make a change to a work plan. That doesn't make sense to me, but that's the way we're set up. We have made it work. It's worked. It just could be more streamlined if we were our own joint powers entity.
And the Snake River is their own joint powers, so
Yeah.
they doesn't have to come back here. That's why I think it's good that they would come and have a little presentation about
Yeah.
what's going on. Cause we don't get them kind of updates as well. It's funny how you said, on the lower St. Croix were the headwaters, on the Snake River were the end of it.
Right.
So, and two of our major bodies of water, Pokemon and Cross are, the last of it. So we had that discussion because there's a lot of activity going on, Pokemon and Cross Lake. And some of the people in the different counties were like, well, why are we spending all the money down there? And it's because they're sending all our junk our way and it's impairing our waters. But it is preventive, if it's being prevented, that's good to see that they have that there. So, but. All right, thanks. Meeting with the city of Pine City. We did, yeah, you want to go?
I thought it was a very, very good meeting and we haven't met specifically with the city of Pine City for a number of years. And so, just trying to get to know people and, we got a lot of things that we do together. Things that we used to do together that we're not doing together and we kind of forgot, but, we've got some items we'll bring up at our transportation meeting later today and, nothing that's not solvable, but it takes communication, so.
Yeah, I thought it was a very good meeting. It was me and Steve and David and their administrator Marcy and the mayor Kent and their councilman Dan
Swanson.
Swanson. And yeah, it was just kind of a nice, some of the comments were between these four walls, so it was kind of, we had that kind of communication, so it was nice. We could say a few things and I just thought it was really good. Our plan is to meet again in a couple months. Next month, yeah.
Yeah.
We're gonna meet right away, cause we had a little bit of an agenda and we didn't get through it all. Yeah, so we'll see how this goes. Pine County Education Leadership Network. We had 3 of us go. You wanna start, Roger?
It was a good meeting. Every meeting has been good so far, yes.
It was.
It's the first school one that I've gone to, so there.
Guy from Willow River actually did a lot of work putting demographic information together, which is interesting to me. And to see the population shift and what schools are concerned about is, of course, if they project 20 years from now, our student age population is declining. The overall population of the county is actually going up, but there's a lot of people my age that moved to Pine County and they don't necessarily have kids in school. So.
But that's always good because they help pay for it. And,
Yeah.
So, no, I thought it was very good too. Some of the themes and trends were declining, student enrollment, but like I said to everybody, because there was a little bit of gloom and doom and I'm like, you can't control that though. I mean, if the population's declining, the students are gonna decline as well. So to not maybe focus so much on that, and focus on, what they can control. And part of the other problem is there's a lot of options for schools nowadays, homeschooling and charter schools and online and that kind of stuff. So they're getting affected by that, but I do think there's a lot of good leadership represented from every school district, wasn't there?
Yeah.
That I'm pretty confident that they'll figure it out. So, did you have anything to add? Okay. All right, Central Minnesota Council on Aging.
We met, probably our one meeting a year that we meet actually in person. And we met with our advisory committee and actually heard from the head of the Minnesota Aging Board that kind of controls our money, and money's tight. Even though our aging population in central Minnesota has been on the increase for a number of years and is projected to continue to increase, we're doing it with less funding, and the needs definitely have not gone away. So I'm concerned about the 276 people in Pine County that get meals on, or the congregate dining sites and Meals on Wheels. I mean, it's not a huge amount of our population, but it's people that we're concerned about and nutritionally dependent on those meals, and it's so we got to keep our eyes on that ball.
Mr. Chair?
Yeah.
If I could just do a follow-up to what Steve was talking about. And so in that program, the county makes a contribution of about $3,000 per year that shows up in the Health and Human Services budget. And so for 2026, you're going to see that called out as something that you should be considering whether you want to contribute that or not. Typically, that has just been built into the base budget, but we know that with 2026, money is going to be extremely tight. Health and Human Services is going to be extremely tight. And so we are asking folks to really identify virtually anything that is discretionary in the budget so that you guys are going to have the opportunity to wrestle with that.
Okay. Thank you. Northern Counties Coalition. Yeah.
Yeah, I did go. About half the people there were online, which I was online, not in person. Three things that came, actually four. One was a review of the legislative meeting that they had, and I think Josh, you attended that. So we, it's always nice to look back and say, well, was this a good thing? Did they do? And then they thought it was all very positive and it had a lot of substance to it. It wasn't just a fluffy thing. So it was intent to continue that. Number two item was the PILT funding. They had a very nice breakdown of the whole state as far as what our PILT money is that we have received, what's scheduled to be received, and what the governor's budget is proposing. And some counties, it doesn't really affect them. Some counties, which are all part of the Northern Coalition, it affects them tremendously. Pine County, to the effect of 300,000. So sometimes that doesn't get a lot of press. We've talked about the cuts in Health and Human Services, which are dramatic, and the cost shifts. But here's another one to add to that list. So again, lobbying, keeping your eye on what's going to happen there. And getting back to the Health and Human Services, the proposed cuts that were coming there was a suggestion, and I think AMC perhaps is working on this. They talked about this subcommittee, and they were saying, okay, if they're saying there's going to be some mandated cost shifts, then the question is, okay, either we just say we complain about it, but we suck it up and we pay all those, or do we I don't know, hand in hand, if they're going to propose these cuts, which mandates do we want to see go away specifically, or what services would you like altered? And if the counties present a united sort of, and that's kind of difficult because we talked about, well, some people are going to say we don't want any cuts. All these services are important, and I get that. But at the same time, is that what we really want? Is them to, this way we have if we present okay, if you're going to cut our funding, then let's reduce the burden of these specific mandates and be united about that. So I thought that was a great proposal. I believe it's through a subcommittee in AMS that's working on that. So they seem to be really on board with that. And they said, the idea was, we don't have much time because the legislative session's theoretically going to be ending here in, a couple of weeks. But theoretically, but we need to have some sort of proposal out there. We really do. Otherwise we're just complainers, So, and the last thing was regarding, so what are counties with all this budget stuff? What are counties doing now? And some counties are saying, actually a fair amount that were there, saying they're already making cuts to this year's budget in preparation for next year. So it was interesting to hear. I didn't ask what specific areas, but so it was interesting to hear that. So yeah, that's my report.
Okay. Is there any other? One thing I'd like to say about the committees, is for us commissioners, they are very important for us to attend these committees. And I appreciate you guys that are going to these. We all have a lot of them, but we are a third of the way through the year and I think, we just gotta make sure we get to these because they are important. They're important for us to go. They're probably a bigger part than, probably one of the most important part of our jobs as commissioners is to go to these committees. So if you're having an issue getting to them, figuring them out, anything like that, work on it. So we don't hear, and I get it. I've missed my fair share as well. But let's try to put a little more effort on some of these to get to them or find a substitute to go to them if possible. Otherwise, take a peek at the upcoming meetings. And we are going to close the meeting and move into a closed session to talk about labor negotiations. We got a few negotiations that we're gonna start here, hopefully, well, sometime this year. So maybe we just want a little better direction from the board. So I'll need a motion.
Mr.
or
Chair,
yeah.
before you close, maybe if I could just, for general information, my intent, and obviously the board can do what the board will do, my intent is just to have a relatively short conversation, distribute some information, get some feedback on what information you might be interested in relation to preparing for labor negotiations, and then there would be no decisions that would be made. And so just so if anyone's watching, I would not anticipate any decisions.
Yeah. And are we gonna do it in here or are we gonna?
Yeah, if we can stay in here, Ryan will halt the video recording and broadcasting
Okay.
until we come out of
So
closed meeting.
this,
May I read that?
yeah, you got it down there in. bold.
Yeah. I move to close this meeting as provided by Minnesota statutes. 13D.03 to consider strategy for labor negotiations, including negotiation strategies and development discussion, and review labor negotiation proposals pursuant to Minnesota statute 179A.01 and 179A.25.
Second.
All right, we got a second? Roger, second. Okay, all those in favor, say aye.
Aye.
Oh, same thing.
Can we take a 2-minute?
Yeah, just take a 5 minutes to get people out of here. that on a board meeting. Good. All right, so we are back in open, session. Out of closed session, whatever I'm trying to say. So with that, I will declare